Hi, this is Julian Segan from Melbourne, Australia. I'm reporting for Room Now at the ACR Convergence in Philadelphia 2022. This is day 2 and it's quite cold here. So I wanted to talk to you about abstract number 0925. This is the impact of initiating biologic and targeted synthetic disease-modifying agents on pain medication use in patients with rheumatoid arthritis. So we know that chronic analgesia use in patients with rheumatoid arthritis and other rheumatic diseases is very common. The complications of opioid use and other analgesic use, for example, neuropathic agents, are well established. This study used insurance claims data from 2009 to 2020 on more than 30,000 patients with rheumatoid arthritis who were initiating their first biologic or second-line biologic or targeted synthetic disease-modifying agents. It looked at the trend of medication use over time, including opioids, anti-inflammatories, as well as oral steroids over a 1-year period. Cancer was excluded in this cohort, but they allowed for other comorbid conditions, including patients who had osteoarthritis, which was 50% in this cohort, as well as 20% with fibromyalgia and 30% with peripheral neuropathy. So this study showed that there was a reduction in opioid use, although this was actually quite small. So this was only up to 4% in the population from a baseline use of about 55 to 60%, which is actually quite high. The reduction was mainly driven by reduced use of tramadol as well as hydrocodone. We actually saw an increase in gabapentinoids over time, so this includes gabapentin and pregabalin. The increase was quite small, only 1% from a baseline of 22%, and I wonder if this reflects increasing use and increasing availability in broader society, particularly with medications like pregabalin. There was also a small reduction in oral prednisolone use with a mean reduction of just 2 milligrams. So this study actually provides us quite a high level of data with regards to medication trends over time. It has the usual limitations, including the limitations of using claims data. This study clearly reflects to us that there is residual pain in patients with rheumatoid arthritis, as well as rheumatoid arthritis with comorbid osteoarthritis and fibromyalgia. Pain remains quite difficult to manage, and clearly we need new strategies, including non-pharmacologic management. We also have probably legacy from the opioid epidemic with very high baseline use of opioid medication. So this is Dr. Julian Segan again, reporting from Room Now from the ACR Convergence 2022 in Philadelphia.